much, Minister. And now it gives me great pleasure to introduce our next speaker, Professor Kieran Walshe. Kieran is Director of Health and Care Research Wales and Professor of Health Policy and Management at Alliance Manchester Business School. Kieran, thank you so much.
Many thanks, Ruth. Just give me a moment to get my presentation to come up on screen, and I will be with you as soon as I can. One moment. That's great. Okay, well, many thanks, Ruth. Apologies for that little hiatus. I'm sure it will happen once or twice again during the conference. And many thanks for the invitation to talk to the conference today. It's really welcome to have the opportunity to talk to people from the allied health professionals and the healthcare science professions about the place of research in Wales. And I'm going to really focus on two things in my presentation. The first is what we learned from the most extraordinary 20 months in my professional life, the last 20 months of the pandemic, particularly what we learn about the place of research and innovation and how we use it. I then want to move to focus on the wider research landscape and to give people something of a heads up about what I might think is a tale of two cities, a sort of best of times, worst of times, and some of the opportunities in health and care research which face us as a community and indeed as a country. And then finally, I want to turn to some of the things that Healthcare Research Wales is doing. So I'm Director of Health and Care Research Wales. I'm an academic at the University of Manchester, seconded into Welsh Government for part of my time to lead Health and Care Research Wales, which is a virtual organisation bringing together the interests in health and care research across Welsh Government's Research and Development Division and the NHS in Wales. So turning to the pandemic, what's happened in the pandemic and what does it tell us about the place of research and the use of evidence? From the outset, there has been the most extraordinary international effort to bring research to bear on the problems and challenges of the pandemic, perhaps most obviously the issues of controlling infection, controlling spread, treating COVID, identifying mechanisms for prevention and developing vaccines. And in the UK, that research effort has been led very much by UKRI, which is the collection of research councils, the Medical Research Council, the ESRC and other research councils, and the National Institute for Health Research in England with its devolved partners in Wales, Scotland and Northern Ireland. And we can, that term world leading has become laden with meaning, hasn't it? But we can genuinely say that the UK's contribution in research has been world leading, and that particularly in areas like therapeutics, the UK has punched so far above its weight. But also in the work on variant genomics, for example, and tracking new variants of COVID, where I'd give a real mention to the work in Cardiff, where Wales has been a very important and leading partner in that enterprise across the UK, but also in areas like the development of vaccines and the running of vaccine trials. The approach to research here has been very much to let a kind of thousand flowers bloom. UKRI has commissioned over 350 research projects over that 20 months in an enormous range of areas and spaces. And that has been partnered by and complemented, I think, by a response from the Government Office for Science and the Chief Scientific Advisor, Patrick Vallance, which has been to have some much more directed national core studies in some key areas. A good example would be the ONS-led community infection studies, looking at and tracking rates of community infection over the whole period of the pandemic. Overall, I think the pandemic has driven a coming together of scientific interests across government and the research community, and Welsh Government involvement and Welsh NHS involvement has been something that we can be genuinely really proud of. But, and there are some buts, I think the pandemic's also highlighted for us some weaknesses in the Welsh health and care R&D base and our preparedness for the research opportunities and partnerships that COVID has offered, and I'll come back to that in a few slides' time. It's made us think about what the right approach is for research community priorities and commissioning. Is it best to let a thousand flowers bloom and let the research agenda be driven by the research community, should we do what the National Core Studies have done, which is to have a very strong mission focus on developing the research that's needed to answer the questions for the NHS and for government. It's made us realise that actually we're good at some stuff, vaccines, therapeutics. We've been much less good at, and we've had a slower start in areas like behavioural science and infection transmission in environmental settings. You look back at our debate most obviously about aerosol transmission, the role of face masks, social distancing and other forms of mitigation, and you think we should have been better than we have been in that, and we should have known the science better from an early stage. It has changed the way we've done research to make it hopefully better and faster. You know, approval processes, which used to take months and months, suddenly we discovered we could do those in less than a week. Data linkage, which has been paralysed by concerns, legitimate concerns about privacy and confidentiality. Data linkage has been absolutely essential to understanding things that we couldn't have known about without linking big data sources. The most obvious example for me of that is the studies of vaccine effectiveness, where we've had real world data on vaccine effectiveness coming out week by week from the vaccines programme. And publication, where we have seen a huge shift towards pre-publication with some pluses and minuses about it. I think one of the big negatives for me is just the way in which science, the media and the public have interacted, and the way we found it very difficult to communicate clear and well understood scientific messages. Science has become embroiled in ideological controversies, and social media has played an extraordinarily toxic role in the development of debates, and I think has done an incredible amount of harm. What have we learned? Well, research matters. That fundamentally the way out of this pandemic was research and the innovations that come from research. We went from, at the beginning, having too little evidence about lots of the questions we needed, to quite rapidly ending up with the challenges of staying up to date with a hugely rapidly expanding field of publication, not just in the UK, but globally. We've learned that research has got to move at the pace of the pandemic for it to be useful, and so some of those old models of research commissioning weren't fit for purpose. There's been an increasing need, driven by the research body of knowledge, for evidence synthesis and knowledge mobilisation. And in Wales, we've needed to find ways of taking that big body of knowledge and contextualising it to the particular issues and priorities driven by Welsh Government policies and the structure and form of the Welsh NHS. One of the things we did in Health and Care Research Wales was to get funding to support the development of a COVID-19 Evidence Centre, which is led by Adrian Edwards from Cardiff, with partners from a number of institutions across Wales. And essentially, I think this has been a really useful development in providing rapid evidence synthesis, sometimes turning around questions arising from policymakers in 2 or 3 days to provide a rapid take on what the evidence says and its meaning and its implications for policy, and then going on to do rather longer and more in-depth studies, drawing the evidence together to inform decision making. And I think there's a lesson out of that work, which I'll come back to, that kind of rapid use of evidence to inform policy making and practice decision making is both incredibly useful and really important going forward. Turning to the sort of the wider picture and where we're going, Health and Care Research Wales, we basically exist to do 4 things: to try and frame the agenda and strategy for R&D in health and care R&D in Wales, to try and plan and fund and organise to bring the funding together to support health and care research in Wales and maximise Welsh engagement in UK and international research funding, working to create and sustain capacity and capability in the NHS, in boards and trusts, but in Welsh universities and other institutions as well, to do the research that is needed, and working to see research used in bringing about innovation and improvement. That's essentially our 4 tasks. I'm going to return to those on my final slide. But first, I just want to move to that second area, which is thinking about the wider landscape. And there's a lot going on in the last 6 to 12 months around research and innovation in the UK and in Wales. So Welsh Government has set out 5 main research and innovation priorities, and 2 of them I think I wanted to highlight. Number 3 on the list, you'll see that health and care research and life sciences research is one of only 2 areas that Welsh Government has said specifically are particular focuses for investment in Wales. So it's seen as a real strength for the Welsh research economy and an area for investment and support. And then first on the list, you'll see that one of the priorities, the first priority, is to ensure that Wales gets a fair share of UK R&D funding. And I want to turn to that and just explore that in a little bit more detail with you. What does that mean? I mean, everyone will have seen, I'm sure, in the press. I skipped over a slide, my apologies. There. Everyone will have seen, I'm sure, in the press, a great deal of coverage of this question of levelling up. The promise to level up the UK economy. Well, the UK has probably the most asymmetrically distributed research economy in Europe. And there are lots of studies that suggest that that is really bad for the UK, and it's particularly bad for those areas that see sustained underinvestment, one of which is Wales. So Welsh Government, in response to UK Government's language and rhetoric about levelling up, is saying very clearly that we need to deal with those disparities. We need to see devolved governments much more actively involved in decision making at a UK level on UK science policy and investment, and that levelling up should involve essentially not just making good the past inequality, but seeking to build and support capacity. Let me give you a picture of how things look at the moment, or have looked in the past, certainly. That's a graph showing the distribution of health research funding by UK nation and region in 2018. And what you can see is that Wales gets about 2.4% of all health and care research spending in the UK. So roughly half what you would say was the population proportionate share. And you can see that, for example, Wales gets about a quarter, less than a quarter, of the spending that goes to Cambridge alone. So that's just one university. So that illustrates that very vividly, that point about the asymmetric of spending. Why is spending asymmetric? Well, government spending comes in 2 ways. It comes from Welsh Government, and it also comes from UK Government. So at the moment, departmental health research spending on across the UK varies quite widely. And actually, the Department of Health and Social Care in England spends much more by proportionate share on health and care research than its equivalents do in Scotland or Wales or indeed Northern Ireland. So that's one source of the disparity. And you can see the figures there in front of you showing, what the difference is. Broadly speaking, they spend about 60% more than we spend in Wales. The other source of funding for health and care research comes particularly through UK Research and Innovation, the research councils. And what you can see from this chart is that spending is also highly asymmetrically distributed, that actually Wales is, if you look at the right-hand column, the least well-funded area in the UK for research council spending per head of population. You compare the funding, for example, in Wales with the funding, say, in London, and there's a certain disparity that you'll notice there. Yeah. This is, I said earlier that, in the pandemic, one of the things we realized was we weren't well placed to take up the opportunities that arose from COVID-19 research investment. So this slide illustrates that pretty vividly. The UKRI ran a number of COVID-19 research calls during 2020 through to early 2021. And this analysis just breaks down the 500 or so projects that were funded through those research calls, spending something like well over £200 million. And you can see where that funding went by principal investigator, by lead investigator. And you can see that the great majority of it was spent in England. That Scotland did pretty well, actually, in comparison with its population proportionate share. That Wales and Northern Ireland didn't do as well as they should do, given their population. And that's really about the research system being ready to mobilise itself in order to take up opportunities and to engage in those funding opportunities. They all happened really quickly. And so if you're already there with ideas, proposals, teams, networks, institutes, and the capacity, then you were really well placed to take up those opportunities. So I think that call really did illustrate a challenge of capacity and capability for the Welsh health and care research system. In 2021, the Senedd Cross-Parliamentary Group on Medical Research published a report with a set of recommendations, having looked at these issues in some detail. And I think the recommendations are really important. The first one is important, but it's not the only recommendation. The first recommendation was that we needed to match UK levels of spending in the QR grant to universities and in health and care research spending. But the other 4 recommendations on that slide are really important as well, that we need better collaboration across and outside Wales, better engagement with industry and better engagement in the NHS in research. But that issue of networking outside Wales and being genuinely outward looking is particularly highlighted. The third recommendation, that we need to do more to support careers. I'm going to come back to that, and provide the kind of opportunities for research careers for clinical academics, for clinicians, and clinicians does not mean doctors in this context, it means clinicians and clinical scientists, and continuing support for things like the Sir Cymru scheme, that we need to do more to make sure that patients and the public have access to research and equitable access to new therapies in clinical trials, and that we need to work on research impact. And I've referred already to the kind of work we've done around COVID-19 and the Evidence Centre. This is my second to last slide, but it's a really important one, because in October, UK government published its comprehensive spending review, setting out its spending plans for the next 3 years. And this is kind of the best of times, not the worst of times part of my narrative, because what the CSR set out was a commitment to increase the overall investment in public research and development, government spending on R&D, to £20 billion a year by 24-25. That's about a 25% increase in real terms over those 3 years. And it's part of what you've heard from UK government as the ambition post-COVID for us to be a science superpower. They also published, before the CSR, a life sciences vision, which set out a commitment to the life sciences as one of the major areas of real industrial and academic strength in the UK, paralleling that earlier commitment I set out from Welsh Government. And it set out plans for major investments in 7 mission areas, very much building on the ideas of the vaccine task force, in saying if we can get academia, industry and enterprise together and really focused on a given mission, we can make great progress together. And the mission areas are things like dementia, obesity, mental health, cancer vaccines, and there are others too. Within that overall increase in spend, there's a big uplift in the research budget for BEIS, which is the government department that sponsors UKRI. That's a rise of £3 billion in cash terms, and that creates real headroom for UKRI and others to respond to the levelling up agenda. And really importantly, the CSR includes, and I put it in boldface here, an explicit priority to increasing R&D investment outside the Greater South East of England as government investments in R&D grow over the next 3 years. At the same time, the CSR set out an increase in the budget for the Department of Health and Social Care in England to bring its overall budget from 1.3 billion this year to 2 billion in 2024-25. So that's a cash increase over 3 years on the current budget of £605 million per annum. And by 24-25, the consequentials, that's the money that comes to Welsh Government as a result of spending in England, the consequentials of that will be about £118 million a year. So that's a huge uplift, both in UK spending and in DHSC spending in England, which brings consequential income to Welsh Government. So there is a massive opportunity for us to see greater investment, and also a challenge for us to make sure we take up these opportunities and that we don't drop the ball. My final slide. So what are we doing in Health and Care Research Wales? We have been working really hard on that larger agenda that I've just set out to try and make sure that colleagues in Welsh Government, that colleagues in UK institutions like UKRI are all pointing in the same direction on things like the levelling up agenda and the opportunities for greater investment. On our 4 priorities, that are the 4 things that we do, I just want briefly to finish on some things we're doing around each of those. So on setting the research strategy and agenda, we are increasingly working with stakeholders to try and create really strong, viable and investable research plans. A good example would be the work we've done over recent months on cancer research in Wales, where we've been trying to make clear that we have some distinctive cancer research strengths in Wales, that we understand how they fit with the wider UK landscape, and that we can make them attractive for inward investment by cancer research funders like Cancer Research UK. Second, planning and funding the health and care research which is needed. This is very much about increased investment, but it's also about making sure the research we do meets the needs of Welsh Government, the programme for government, and of the Welsh health and care system. And I think there's a lot to take from our experience during COVID of making sure research is policy facing. The third is to create and sustain capacity and capability. And there we're going to be publishing quite shortly a report we've been working on for months with Health Education and Improvement Wales and others on research career pathways for academics and healthcare professionals. There is a really major need for investment in that as an area to give people the opportunity to follow a research career and to move into research from backgrounds in the professional disciplines. And the fourth is to build on to promote the use of evidence. And there we really want to build on what we've learned from the COVID Evidence Centre to increase evidence use in Welsh Government and the NHS, and to build on opportunities for things like rapid evaluation. So I'm going to finish there. I'm conscious I've gone a couple of minutes over time. My apologies, Ruth, but I think it is genuinely a time of huge opportunity in health and care research and innovation. Thank you.
Not at all, Kieran. That was absolutely excellent. I'm burning with questions, and I've made notes of them so I can capture them in the panel later. And I urge everyone else to do the same as well. Thank you so much. Really, really appreciated that. So I know you're going to join us for the panel at 11:20.